Rift Valley fever was first discovered in 1931 during an investigation into an epidemic among sheep in the Rift Valley region of Kenya. The disease is caused by the Rift Valley fever virus, which primarily affects animals, particularly domesticated livestock like sheep, cattle, and goats. However, the virus can also infect humans, typically through contact with the blood or tissues of infected animals, or through the bite of infected mosquitoes. Rift Valley fever is a viral disease that primarily affects animals, particularly domesticated livestock such as sheep, cattle, and goats. Humans can also become infected, and the infection routes include direct contact with infected animals. Humans can become infected with Rift Valley fever virus through direct contact with the blood, tissues, or bodily fluids of infected animals. This typically occurs during handling, slaughtering, or butchering of infected animals. Farmers, veterinarians, and workers in slaughterhouses or meat processing plants are at a higher risk of infection due to their occupational exposure. Mosquito bites. Rift Valley fever virus is transmitted to humans through the bite of infected mosquitoes, primarily of the Aedes and Culex species. Mosquitoes become infected when they bite infected animals and can then transmit the virus to humans and other animals when they bite them. Ingestion of contaminated products. Consuming raw or undercooked meat or milk from infected animals can also pose a risk of infection, although this is a less common route of transmission. Aerosol transmission. In rare cases, the virus can be transmitted through the inhalation of aerosols produced from infected animal tissues or fluids, particularly during laboratory work or other activities that involve handling infected samples. It is important to note that Rift Valley fever is not transmitted from person to person. To prevent infection, it is crucial to take precautions when handling animals or animal products, use personal protective equipment, and control mosquito populations in areas where the virus is present. Rift Valley fever, RVF, primarily affects animals, but humans can also become infected with the virus. In humans, the symptoms of Rift Valley fever can range from mild to severe. They typically appear within 2 to 6 days after exposure to the virus. Mild symptoms may include fever, general weakness and fatigue, muscle and joint pain, headache, nausea and vomiting. Most people with mild symptoms recover within a week, and some may not experience any symptoms at all. However, in a small percentage of cases, the infection can progress to more severe forms, which can be life-threatening. Severe symptoms may include hemorrhagic fever. This form of RVF can lead to symptoms like bleeding from the gums, nose, or other body parts, as well as blood in vomit or stool. It can also cause a rapid decrease in blood pressure, shock, and death. Encephalitis. In some cases, the virus can cause inflammation of the brain, encephalitis, which may lead to symptoms like severe headache, neck stiffness, confusion, seizures, and even coma. Retinitis or eye disease. RVF can cause inflammation of the retina, retinitis, or other parts of the eye, resulting in symptoms like blurred vision, eye pain, sensitivity to light, and even permanent vision loss in some cases. Severe cases of Rift Valley fever may require hospitalization, and the fatality rate for these cases can range from 1% to 50%. It is essential to seek medical attention if you suspect you have been exposed to the RVF virus and are experiencing symptoms. Early diagnosis and treatment can improve the chances of recovery. There is no specific antiviral treatment for Rift Valley fever, RVF, in humans. Treatment primarily consists of supportive care to manage and alleviate symptoms, as well as address complications that may arise from the infection. For mild cases of RVF, treatment may include rest. Adequate rest is essential for recovery. Hydration. Ensuring proper fluid intake helps prevent dehydration caused by fever, vomiting, or diarrhea. Pain relief. Over-the-counter pain relievers and anti-inflammatory medications, such as acetaminophen or ibuprofen, can be used to alleviate fever, headache, and muscle or joint pain. However, aspirin should be avoided due to the potential risk of bleeding in severe cases. For severe cases, patients may require hospitalization for close monitoring and treatment of complications. This can include intravenous fluids, to maintain hydration and electrolyte balance, blood transfusions, In cases of severe hemorrhagic fever, blood transfusions may be necessary to replace lost blood. Oxygen therapy. If the patient has difficulty breathing, oxygen therapy may be administered to ensure adequate oxygen levels. Anti-seizure medications. In cases of encephalitis with seizures, anti-seizure medications may be used to control and prevent seizures. Dialysis. In severe cases where kidney function is impaired, dialysis may be required to support kidney function. Prevention is crucial in controlling Rift Valley fever outbreaks. This involves vaccinating livestock in areas where the disease is prevalent, controlling mosquito populations, and taking precautions when handling animals or animal products to minimize exposure to the virus. Livestock vaccination. Vaccinating livestock, particularly sheep, cattle, and goats, is one of the most effective ways to prevent RVF outbreaks. There are different types of vaccines available, including live attenuated and inactivated vaccines. Vaccination programs should be implemented in areas where the disease is prevalent or has a high risk of occurrence. Vector control. Mosquitoes, particularly the Aedes and Culex species, are the primary vectors that transmit the RVF virus. Controlling mosquito populations is essential to reduce the risk of infection. This can include eliminating standing water where mosquitoes can breed, using insecticides to target adult mosquitoes and larvicides to target larvae, introducing mosquito predators, such as fish or other insects, in water sources, using mosquito repellents, bed nets, or screens on windows and doors to prevent mosquito bites. Personal protective equipment, PPE. People who work with animals or animal products, such as farmers, veterinarians, and slaughterhouse workers, should use personal protective equipment when handling potentially infected animals or tissues. This includes wearing gloves, masks, goggles, and protective clothing to reduce the risk of exposure to the virus. Safe handling and disposal of animal products. Proper handling and disposal of animal carcasses, tissues, and fluids can minimize the risk of infection. This includes disposing of carcasses and tissues in a safe and sanitary manner, washing hands thoroughly with soap and water after handling animals or animal products, avoiding contact with sick animals or animals that have died from unknown causes. Safe food practices. Consuming raw or undercooked meat and milk from infected animals can pose a risk of infection. To reduce this risk, ensure that meat and milk are cooked or pasteurized properly before consumption. Additionally, practice good food hygiene and follow food safety guidelines when handling and preparing animal products. By implementing these prevention measures, the risk of Rift Valley fever outbreaks can be minimized, protecting both animals and humans from this potentially severe disease.